This is the third in a series of videos about glaucoma. Module 3, Advocacy and Raising Awareness of Glaucoma. The learning objectives for this module are to understand the concepts of advocacy and raising awareness of glaucoma, to learn the key messages to stakeholders in a glaucoma service, and to recognise the benefits to the community of taking the recommended actions. Advocacy is a planned form of influencing in order to achieve a specific outcome. It involves representing the needs and interests of disadvantaged groups, for example, vision-impaired people with glaucoma. To those who can influence change, for example, policymakers, planners, heads of clinical care institutions, eye health practitioners, etc. The effectiveness of advocacy initiatives depends on the close collaboration and inclusion of all relevant stakeholders, on agreeing on joint positions and priorities, and on carrying them forward. An influencing strategy has 3 elements. 1. Target audience. 2. Influencing objectives for those audiences. And 3. Key messages to be used to engage them. Raising awareness in general population typically involves a sustained effort to educate the public and boost their knowledge about a certain thing, in this case, glaucoma. Just as in advocacy, the target audience is to be defined and easily understood key messages transmitted using all angles through mass media, social media, and various other channels of communication to the public. Activities such as free eye examination, public health talks, awareness walks, etc., for observing special health days also boost awareness. For example, World Sight Day in October, World Glaucoma Week in March, World Diabetes Day, November, etc. In this section, we present relevant information that can be fashioned into key messages to communicate to the public, with good evidence base for advocacy and raising awareness in the general public. These messages can be adapted to the local language, simple English, or technical language, depending on the target audience. They can also be used as content of glaucoma patient information leaflets for clinicians to give to patients. Message 1 is, what is glaucoma? Glaucoma is a neurological disease affecting the optic nerve, causing loss of peripheral vision and ultimately blindness. Certain characteristics, such as raised eye pressure, intraocular pressure, increased age, 40 years and above, African Caribbean origin, and family history of glaucoma are associated with increased risk of the disease. What is the problem with glaucoma in Africa? Glaucoma is a public health problem in sub-Saharan Africa for the following reasons. Number 1. The prevalence of blindness due to glaucoma is higher than in other regions of the world. 2. It has a more aggressive course, leading to blindness faster in a shorter period of time compared to Caucasians. 3. There is a higher rate of the disease among young people. 4. Patients present to hospital late and are diagnosed with advanced disease, often blind in one eye. 5. There is poor acceptance of surgery, the preferred treatment in Africa, as patients experience no immediate visual benefit and are fearful of the procedure. 6. There is poor adherence to medication, for so many reasons ranging from non-availability to forgetfulness to use the medicines. And 7. People of African origin are less responsive to both medical and surgical treatment options used for glaucoma. How can glaucoma be treated? Of all the risk factors for glaucoma, the only modifiable risk factor is IOP, intraocular pressure. Lowering the IOP has been associated with reduced progression of visual field defects. Many different treatments exist, and most aim to reduce IOP. Which treatment is given depends on several factors. For example, the stage of disease at presentation, the socio-economic and demographic features of the patient, such as level of awareness, family support, household economic situation, distance to the health facility, etc., or the resources available, and the preference of the patient. A once-off treatment, surgery or laser, is probably the best option for advanced disease in many Africans. Those who are poor and lack support, and where facilities for monitoring and follow-up are lacking, or the patient is not motivated. The medical treatment options use different classes of drugs. Topical ocular hypotensives are the most frequently used and are effective not just in treating high IOP, but in delaying or preventing the onset of glaucoma in African American individuals who have ocular hypertension. Drops and how to take them. Whatever type of medicine is prescribed, it is important that patients are given the correct prescription and obtain the drug prescribed. Store it in an ideal environment. Use the drugs as prescribed at their right times, and continue to do so as instructed. It is essential that patients and their carers are taught how to instill these medications correctly, as this will reduce waste. This is vital because many glaucoma patients, in addition to visual impairment, may have other age-related chronic disease like tremors or arthritis, which make the seemingly simple act of installation difficult. Surgical treatment. Although surgery has been demonstrated to be the best treatment option for controlling eye pressure, acceptance is poor in African patients, mainly because of fear and the lack of visual improvement after the surgery. There are many surgical options, but the most effective involves creating a new channel in the eye to increase outflow of aqueous humor to lower the pressure, an operation called trabeculectomy. Other surgical techniques, including new minimally invasive surgical procedures and implants, are also available. Trabeculectomy is the operation of choice in African populations, where it offers good IOP control, but it has a higher risk of failure from excessive scarring than in Caucasian eyes. So appropriate precautions are used to avoid this. The outcome of trabeculectomy in Africa is variable, but it generally offers good IOP control in the majority of patients. Laser treatment is used to either decrease the production of aqueous or increase its drainage. Different types of laser are used, but all aim to decrease the eye pressure to prevent further damage to the eye. The advantage of laser treatment is its non-invasiveness, good control of eye pressure for a long period, and ability to be repeated if it fails. The main disadvantage is lack of availability in many eye care centres in Africa. The more popular options include selective laser trabeculoplasty, SLT, argon laser trabeculoplasty, ALT, micropulse laser trabeculoplasty, MLT. Laser trabeculoplasty increases outflow of aqueous and offers good short-term IOP control. Another option, called cyclodestruction, has been in use for refractory glaucoma, especially for pain relief. It is usually carried out with the diode or YAG lasers through the sclera or under direct vision combined with cataract surgery, called endocyclophotocoagulation. Transscleral diode laser cyclophotocoagulation is receiving increasing support not only for eyes with refractory glaucoma, but also those with uncontrolled IOP with residual good vision. Next, we look at key messages to different levels of decision makers. So at the facility level, 1. Inclusion of glaucoma screening as part of every eye checkup, especially in people over 35 years coming to eye clinics for reading glasses. 2. Creation of special glaucoma control units in communities and facilities. 3. Encouraging change in acceptance and adherence to treatment and follow-up through proper counselling. 4. Encouraging the creation and functioning of glaucoma support groups in hospitals and communities. Key messages at the community level. Number 1. There is very low level of awareness of the risk of having primary open-angle glaucoma. Community leaders are to participate in awareness creation to encourage eye checkups in ensuring reduction of blindness prevalence from glaucoma in their constituency. Number 2. Increasing awareness creation by education through the mass media and at every available social occasion to emphasize the need for regular eye checkups to catch the disease early to prevent blindness. 3. Increased awareness creation using social media. And 4. Eliminating stigma associated with blindness in communities. Key messages to health managers or hospital directors. Number 1, although there are policies and budgetary allocations for other health services, a policy and budget line that addresses glaucoma needs to be established in government institutions. And 2, there are several non-governmental organisations, NGOs, working in collaboration with government agencies, but they must ensure glaucoma becomes a priority. There is a need to prioritise glaucoma for control. Key messages to health commissioners. 1, there is reduced access to treatment, especially in rural areas. State infrastructure needs to be able to support easy access to eye care facilities for patients. 2, proper rehabilitation of those who are blind should be an integral part of continuing care in health institutions. 3, there is a lack of primary eye care and awareness, which can be addressed by implementing the integration of primary eye care into mainstream primary health care. 4, health facilities are poorly equipped to manage the disease, so there is need for mobilisation and training of more human resource for glaucoma care. Continuing with the message to health commissioners. 5, there is an inadequate human resource in health facilities to manage the disease. 6, there are limited treatment options available to many physicians to treat the disease. 7, there is very poor adherence to medicines for treating the disease. And 8, there is a need for more research into the epidemiology of the disease to update the existing data. Regarding health financing, or the economic argument. 1, advocacy to governments and opinion leaders to create awareness for glaucoma and improve budgetary allocations for its care. 2, the search for more sustainable means of funding glaucoma care in the community. And the message to the state or federal Ministry of Health is: 1, there is an existing government policy on integration of primary eye care into primary health care to enable screening and early detection of most causes of blindness, including possibly glaucoma, at primary level. We need to advocate for proper implementation of this objective. 2, although there are policies and budgetary allocations for other health services, no existing policy or budget line that addresses glaucoma is established in government institutions. There is a need for this provision in the budget of ministries and governments. 3, there are several non-governmental organisations, NGOs, working in collaboration with government agencies, but none of these presently has glaucoma as its main focus. There is a need to encourage a glaucoma control programme in partnership with the relevant NGOs. The benefits to the community for taking recommended actions are: 1, reduction in the prevalence of blindness in the community, thus reducing level of dependency. 2, improved social standing of individuals by avoiding stigma attached to blindness in many communities. 3. Improved quality of life for patients through improved access to treatment and rehabilitation for those already blind. And 4. Improved vision will result in greater future productivity, which will have a positive impact on economic growth and social integration. That concludes the module on advocacy and raising awareness of glaucoma. Write down any questions you have about this module and be sure to have them answered. Ask yourself, what am I going to do as a result of this learning? Check that you have achieved the learning outcomes for this module. To understand the concepts of advocacy and raising awareness of glaucoma. To learn the key messages to stakeholders in a glaucoma service. And to recognise the benefits to the community of taking the recommended actions.